Welcome, everyone. Welcome to Navigating SNAP Program Basics and the new HR1 requirements. The Seattle-King County Coalition on Homelessness is proud to present this in partnership with Solid Ground Benefits Legal Assistance. If you signed up for that training, you are in the right place. A reminder that this training is being recorded and will live on our YouTube channel along with all of our other trainings and meetings, so please check back when you need. This training is also supported with ASL interpretation. My name is Kevin Lee, and I am the Programs and Member Services Coordinator here at the Seattle-King County Coalition on Homelessness. The Coalition on Homelessness mobilizes our community to challenge systemic causes of homelessness and advocate for housing justice. We are a true coalition of organizational members, individual members, and volunteers, and we welcome you all to join us. There will be a lot of information today, and I want to assure you that we will be getting the slides out for this training out along with the recap. We have carved out time during today's training for advocacy action for all of us to engage in. This is a value of our coalition to provide good information to help people get their needs met and take collective action together. So for getting us started, we want to do a bit of framing for all of the things that will be addressed in today's training. This is not just any training. This is a training about massive changes that will impact millions of people nationwide. HR1, also known as the Big Bad Beautiful Bill, is starting to take effect. Food benefits is one of the first programs where people will lose access to benefits. These changes are intended to limit people from accessing food benefits through SNAP. We know that the most vulnerable will be disproportionately impacted, including people experiencing homelessness and with disabilities. The changes to the SNAP program are now the largest changes to eligibility since the 1996 Federal Welfare Reform Act. Benefits legal assistance staff are going to explain what is happening, what is changing, and how you can help the folks you work with to the greatest extent possible access their benefits, and how to not be a passive bystander in this moment in history. We get to hear from some very knowledgeable presenters today. Our partners from Solid Ground Benefits Legal Assistance. We have Patricia Bowen, Program Manager, and Tanner Yamada, Benefits Attorney. And with that, I'll let them go ahead and take it away.
Thank you, Kevin. I'm going to start sharing my slide. Everyone see it? Can I get an okay?
Yeah,
perfect.
let's get some confirmation. Yes, thumbs up. Okay, great.
Yeah, looking good.
Perfect. Okay, so like Kevin said, we are a team of attorneys. We do offer legal services. My name is Patricia Bowen. I'm the program manager for Solid Ground's Benefits Legal Assistance. Here co-presenting with me today is Tanner Yamada, benefits attorney. I use she, her pronouns. Tanner uses he, him pronouns. We do have throughout this presentation some time set aside for questions. You are also welcome to put questions into the chat as you think of them. At those question intervals, if you would like to come off of mute and voice your questions, you're welcome to. However, the meeting is being recorded, so please just keep that in mind. So today we are here to talk about food assistance in Washington State, specifically focused on those HR1 changes because we figure that is probably what most of y'all have questions about. Before we jump right in, we always do like to take a moment just to acknowledge the fact that public benefits law in general, and specifically these changes, are steeped in systemic racism. And so you can't really have a conversation about the benefits themselves without acknowledging the history of where they came from, the reality of the situation we're in. That being said, this could be its own presentation, so we're not going to dwell on it, but we do want to list some resources on the screen, and these slides will be shared out. So we really encourage you guys to read those once the slides are shared with y'all. Also, because you're attending today, you do get to participate in what we call our Ask a Lawyer program. So what that means is if you have questions, it can be broad, it can be specific to a client. If you just are really thinking, ooh, I'd love to get a lawyer's look at this, you're welcome to email us. Just email our benefits legal help at solidground.org. well, solid-ground.org. Put in the title of it, Ask a Lawyer, so we know that it's not a client referral, it's just a question, and one of our attorneys will get an answer back to you. And that is available to anyone across the state, not just in King County, which is where we practice. So just a resource for y'all to have after today's meeting. So today we're going to cover a couple topics. We'll start with just an overview. What is the basic food, and what is SNAP versus food benefits available for immigrants? And there are new eligibility designations, so we will spend a little time on that. We'll pause for some questions, then we'll pop into what that application process looks like. And then we will go into what I anticipate will be the most question-heavy portion, which is that ABAWD change. So the able-bodied workers without dependents, which has new rules, and we will happily get into the weeds with you guys on that. As soon as we get through that, we'll kind of wrap up with tips that we have from practicing on how to avoid benefit pitfalls and how to request hearings and what that appeal process looks like. So throughout this, like I said, we'll have pauses for questions, but feel free to put them in the chat as well. Okay, so starting off right in there, what is SNAP? It's the Supplementary Nutrition Assistance Program. It's also called EBT. It's also called food stamps. It has a lot of names. It's all the same thing. And this is the nutrition program that is partially funded by the federal government, but it is administered through the state. So this provides low-income families who meet a income requirement, family size requirement, and citizenship requirement food benefits. Now, it also requires, if you are eligible, that you meet certain work requirements as well, unless you have a very specific exemption for this. Alternatively, our state, Washington, offers what is called FAP, State Food Assistance Program, and that is a program that is meant to fill in the gap. So everyone who meets the income and family size requirements for food assistance, but does not meet the immigration requirement is eligible for, well, not everyone. I wish it was everyone. Nobody asked me. Almost everyone is eligible instead for FAP. So it is administered the same way. It's put onto an EBT card that's sent out to clients that they can use like a credit or debit card. It also administers the same amount of food benefits. So you're not going to get more or less being on SNAP versus being on FAP. Additionally, the income and eligibility requirements are identical outside of that immigration status. And because of that, the work requirement is also identical, and we will get into what that is later. Unfortunately, there is a group of people that this does not benefit, which is those with non-legal status or undocumented individuals who are in our state. We'll get more into the nuances on that as well. We'll get into it right now. So I'm a visual person. I like a chart. So here's a little chart that helps distinguish which pot your clients might fall into. So for SNAP, and like I said, these have changed. It used to be the case that all green card holders and refugees and asylees had access to SNAP. There has been a shift. So now SNAP only covers those who are U.S. citizens, U.S. nationals, lawful permanent residents, so green card holders, COFA migrants, and there's a little explanation at the bottom about what that is, and Cuban Haitian entrants. Everyone else, including refugees, including asylees, has now been shifted into the FAP category. So that now includes all refugees, asylees, and immigrants from humanitarian protections. And unfortunately, like I said, some individuals aren't eligible for either. and that is predominantly undocumented individuals, although it can also include those who are here on a very limited term visa. So if you are here for vacation, business, pleasure, student visas, you're also not eligible. These changes, so if you have an individual who's a refugee who's currently on SNAP, they will be automatically shifted from SNAP to FAP in May when these changes take effect. They do not need to do anything. They don't need to provide any sort of documentation. They don't need to call and update anything. It will automatically be switched over on DSHS's side in May. So this is not more work for them. And in terms of impact to clients, their dollar amount should not change. The way they're getting their money should not change. It will just be coming out of a different pot of money that does not have any federal funds associated. And they will not need to reapply, and their follow-up subsequent like 6-month or 12-month check-in to reevaluate will stay exactly the same. So in a large part, people may not know that they've been shifted over, except that their letters will no longer say SNAP and will just say FAP instead. We get a lot of questions about public charge when it comes to immigration work as well. I will preface this by saying we are not immigration attorneys. We cannot give immigration advice, but we can tell you what the law is specifically as to whether public charge applies to these state benefits. So public charge does not apply to all immigrants. Every situation is a little bit different, and because of that, it's a little bit complicated. However, the rule does not impact lawful permanent residents who are applying for U.S. citizenship. It does not apply for refugees and asylees. I'm not going to read every single designation that it doesn't apply to, but we do have them all listed. It may, however, impact those applying for a green card. This also may change. There have been some pushes lately to allow for any and all benefits to be considered as public charge for consideration. It was quashed last year, but I can't guarantee it won't be raised as a recurring topic of discussion. As of right now, this is the legal advice we can provide. Public charge rules may be considered as well for ongoing cash assistance program, which again, we're not going to get in the weeds about because this is specifically food today, but we'll touch on those in future presentations about those cash assistance. And then people who have very specific questions about this for their clients should reach out to an immigration attorney. Unfortunately, not us with any of those questions, and they can provide specific and accurate and timely advice for that individual. And I'm going to hand it over to my associate, Tanner.
Thanks, Patty. Hi, everybody. Like Patty said, my name is Tanner Yamada. I'm a benefits attorney with Solid Grounds BLA program. Just want to take a minute. Thank you so much for having us. We're excited to be with you guys and share some info about food benefits. This slide has some information specific to homeless youth and food assistance. A minor is not required to have a residence or income to be eligible for basic food. If a minor is homeless and is temporarily living in the residence of an adult who is not their parent and who doesn't provide for them financially, then they're not considered to be under what DSHS calls parental control, and the youth can be in their own assistance unit. Generally, somebody under 18 or even 22 who's living with a biological parent needs to be in the same household or assistance unit for food benefits purposes. That means that the parent's income and other eligibility could impact the youth's eligibility for food assistance. But in the situation of a youth who is temporarily unhoused or temporarily living with an adult who's not their biological parent, that's not the case, so long as they're not financially dependent. What that essentially means, according to DSHS rules, is that they don't receive any sort of significant and sustained financial or other support from the non-parental adult. One thing to keep in mind with this, one kind of caveat, is that if the minor is regularly buying or preparing food with others, regardless if it's a parent, a relative, or just someone they live with, so long as they're regularly buying and preparing food with somebody else, they need to be included in the same assistance unit. So again, that would mean that those other individuals would be required to be in the same household, and their income or other aspects of eligibility could impact the youth applying for benefits. Wanted to touch on the Transitional Food Assistance Program. You guys might hear about this if you work a lot with clients receiving food benefits, especially those who are dual eligible at TANF or used to be dual eligible at TANF. TFA, the Transitional Food Assistance, is a program specifically designed as kind of a bridge for families who are leaving TANF because of increases in their income. The way the program essentially works is that if a household receiving TANF increases income to the extent that they no longer qualify for TANF, they can receive 5 months of additional food benefits at the same level that they were prior to the TANF termination, regardless of how much income they earn. So essentially, it's a bridge for people who are increasing their income, especially to the extent that it could impact their food benefits. There's a 5-month period where the increase of income isn't kind of counted against them, at least with regard to their food benefit. So while the TANF is decreasing and their income is increasing, they can maintain eligibility to food assistance. Also wanted to touch on the WIC program. This program isn't administered by DSHS. It's administered by the Washington State Department of Public Health, but we wanted to touch on it anyway, as it is a nutritional program and we get questions about it sometimes. WIC stands for Women, Infants, and Children. To be potentially eligible for the program, someone needs to be pregnant, postpartum, breastfeeding, or a child up to 5 years old. The program provides assistance purchasing kind of pre-selected food items according to the program, like baby foods, formula, fruits, vegetables, milk, cereal, things like that. Benefits from this program go onto a separate card from an EBT card, but once you're approved for the program, you get that card. So it's possible somebody might have an EBT card and a WIC card, which can cause confusion sometimes. So it's good to know they're two separate devices. To be financially eligible for the program, a household needs to be at or below 185% of the federal poverty limit. For this year, for example, a family of four would need to be at about $5,000 or less. Those numbers are adjusted every June to reflect the new federal poverty limit guidelines that are released in January. So technically this year, we're still working on the 2025 federal poverty limit table. That'll be adjusted in June to go up a little bit. So we're gonna take a break there. This is our first question slide. So I'm not sure if there's any questions in the chat, but if anyone wants to unmute and chime in, you're more than free.
This is Lydia from Lehigh. I have a question. I'm working with a group of asylum seekers. If the older children are enrolled in school for higher education, would they still qualify for some type of food benefits if the primary provider in the household is still the father, but he is currently unemployed?
So it depends, which is the most annoying legal answer I can give you. It depends on where the child is residing, and whether the father is still providing them with any form of financial and therefore food assistance. If the child lives out of the home from the parents in their own domicile, then they could be considered their own individual unit and only their income is considered. If they still live with the parent's income would be considered. You said the father is currently unemployed.
Correct. And these are four adult children between the ages of 19 and 22.
Okay.
They are currently enrolled in the Promise program at
Okay.
Seattle Central. None of them work.
Okay.
They're in school full time.
They should be eligible. I can't give you a distinct answer without knowing all the details, but it sounds like regardless of where they live, if the father is unemployed, they should be under that income limit and they should be eligible. Um, and it just depends where they live in terms of what their assistance unit would look like. But they should be eligible, and I would encourage them to apply.
Thank you.
Yeah. Looks like we have another raised hand. Aaron?
Yeah, I work with a lot of my program works with families raising other people's kids. So I work with a lot of children that are going into like a family's residence or a friend's residence. How does it work if the child is like 12 or under and really isn't capable of managing SNAP or being able to buy food on their own or buy the right kinds of food? If you have like a 12-year-old that's saying, I wanted to manage my own benefits, does DSHS take into account that maybe the guardian should be managing those benefits rather than the child?
Yes. So the homeless youth program that Tanner was talking about likely would not apply in that situation. If a child is living with a parent or a legal guardian, that parent or legal guardian is the one that applies and the one that is administering or receiving administration of those benefits from DSHS. Um, it would only go to the child themselves if that child does not have a uh, anyone, a parent, guardian, etc., that is providing them with a level of care and therefore providing them with food. Likely in a case like that where a 12-year-old is living with I'll be honest, I was a foster kid, so I'm very familiar. When I was in the system, it was my foster parents. When I got older and was living with, families, host families, they were the ones who would be in charge of that. Unless you were unhoused or an emancipated minor, it's unlikely that you yourself as a child would be the one in charge of your own benefits. However, it is based on some people can be eligible for benefits in a household, even if others are not. So, for example, if you have undocumented parents with a US resident minor, the parents are still the ones in charge of the benefit, even though the minor is the only one who actually receives the benefit due to immigration status. So it's still going to go onto an EBT card that is given to the parents or guardian, and it's just money to be used on behalf of the child. Hopefully that answers.
That did.
And I think we have some in the chat. Kevin, do you want to read them? I can't do both.
Yeah, sure. One of our first questions was a little bit high up there, and let me just see if I can pull it here. We had a question about public charge. I think it was just curiosity about what the definition of that term referred to.
Gotcha. I can't tell you the textbook definition, but I can tell you it's basically the idea is in order to become a US citizen, have a green card, you have to show that you will not be a quote unquote financial burden on the US government. And so they look at whether they can look at whether you are utilizing public benefits when making that consideration, along with everything else, to decide whether to approve your green card. And it's under this umbrella term called public charge. Unless you're dealing with people who are immigrants who are seeking that green card status, it's not relevant for this food benefit, but we do like to bring it up because we know that a lot of our community members are helping immigrants in those situations, and we don't want them to be glanced over.
Thank you, Patty. Another question here. I'm realizing it's little bit more of a TANF question. Someone asked, what is the process for accessing TFA after a client's income exceeds TANF limits?
Oh, Tanner, you started talking.
Oh, I was just gonna say it's normally pretty automatic. I've seen it happen almost in all situations automatically. It is something that DSHS is supposed to flag when TANF ends to review whether or not they can switch the basic food to TFA. If that doesn't happen for whatever reason, I would encourage whoever's going through that to reach out to the department. But for the most part, I see that being fairly automatic.
And then we have one more question at the bottom of the chat here. Well, maybe the person had their question answered, but it says, with these changes, will families with one or more working parents who are eligible for SNAP already get an increased benefit amount? That's at the very bottom of the chat. Will families with one or more working parents who are eligible for SNAP already get an increased benefit amount? I'm also trying to process the question.
I'm not quite sure what you're asking. In general, any family that is applying, they will look at the total number of individuals in the household or the assistance unit, and then they will look at the total amount of income of those individuals, see if they are eligible, and the amount of benefits is based on the number of people in that household, and how much they make, so therefore how much need they have of assistance. I'm not sure what you're referencing in terms of increased benefits. You're welcome to come off of mute or put more into the chat if I did not answer your question. I also saw somebody ask, I saw it flash on my screen about whether WIC will have work requirements. We will get to the work requirements part, but just so you know, no. WIC is a completely different program than other food assistance programs. It is administered through a completely different program with a completely different budget, and it does not have work requirements associated with it at all. Any other questions before we move on?
I had a quick question. I was trying to type it, but I wasn't typing fast enough. I work with unaccompanied youth, and I'm just wondering if there's something that would be beneficial to bring to their DSHS interview to prove that they are financially independent. I've run into a couple of kids that have been denied because they've been staying with a friend for longer than 6 months.
Nothing specific. Unfortunately, it is difficult. It's hard to prove a negative. It's hard to prove you're not getting assistance. Outside of if the youth has a job, it's helpful to provide that. I know, older minors sometimes are in that situation, or just declarations from the family members who they're staying, or not family members, the friends that they're staying with, stating that they are financially independent and they are not providing any form of financial assistance. Usually then you also have to touch on the fact that they provide their own food and cook separately. Outside of that, sometimes it unfortunately is a battle of getting them to understand the concept of, not every household looks like the stereotypical household, and getting them to understand those nuances. But the statements can be helpful.
Thank you.
Yeah.
I see one quick question here. Do DACA children qualify for SNAP or FAP?
Okay, over the age of 18, if you're here on a work visa or on a school visa, you wouldn't, but DACA, I believe you would, specifically because, again, it's not a short-term visa, so therefore it's viewed as a longer-term investment. I believe you'd be on FAP, not SNAP, with the new distinctions, but you as an individual and they as an applicant don't need to know which of the two programs they would qualify for. You apply and you're just slotted into the appropriate group. So if I'm wrong and you're applicable or you're eligible for SNAP, you would just be put into that category. My legal inclination is yes, they should be completely eligible.
Yeah, and I'd back that up, Patty. I was just looking at that actually the other day, and I do think based on the new distinction, they would be FAP recipients, but one way or the other, DACA eligible folk would be eligible for at least one of the two programs.
Perfect. Thanks, Tana.
And just a reminder for everyone, we see some great questions coming in. If your question isn't addressed during the training content, we're going to have a few more of these Q&A sessions.
I also saw one more question before we move on. It's children not born in the US can get food stamps. Again, a little bit of nuance. If they are here as a refugee, asylee, green card holder, or lawful immigrant, yes, they can, even if their parents or guardian cannot. If they are undocumented, unfortunately, they are not eligible, just as adults who are undocumented are ineligible. If I didn't get your question, I apologize. We are going to move on for the sake of time, but if I missed it, please feel free to put it in the chat again and we'll loop back.
Okay, we'll keep going here. So this slide shows the basic food allotment or benefit amounts based on household size. I think Patty touched on this in the Q&A portion. The table on the right here, you can see what the maximum allotment would be for a food assistant eligible household, depending on the family size. These go up a little bit every year. I think it was about a 2% increase from this fiscal year, from last fiscal year. So yeah, the chart's right there. The benefit amount someone actually receives depends on the number of people in their household, their level of income, and then the level of deductions they might qualify for. I'll touch more on the deductions that a household could qualify for in a little bit. But generally, it's things like rent and utility costs, any child support being paid out from the household, childcare costs, and potentially qualifying out-of-pocket medical deductions. If you're curious if like the amount that you're receiving is correct, or if you were thinking about applying and wondering how much you could qualify for, there's a really useful tool, snapscreener.com. It's a pretty solid calculator. You input all your financial information, and it normally pretty accurately gives you an idea, at least, about how much you might qualify for, or if the amount you're receiving is the correct amount. So feel free to use that resource. We have a link to it right there, and it's normally pretty accurate. Income limits for basic food. And again, just as a reminder, all these sort of numbers in terms of allotments and income limits apply both to the FAP program and the basic food program. So income limits for either program is normally for most individuals set at 200% FPL or below. Some states it's 130%. In Washington, it's 200%, which is great. The exception to that is people who are receiving TFA, like we talked about before. For those folks, during that 5-month period, they can qualify for food assistance even if their income rises above 200% FPL. But again, for most individuals, that's going to be the income limit there. On the right, you can see the applicable 200% FPL for this year based on family size. Down below in the little box, there's another link to a calculator that you can use to determine if yourself or someone you're working with might be eligible for food benefits. You can find that calculator at washingtonconnection.org. There's a See If I Qualify link that you can follow and put your information in to see if you qualify. We'll talk about this more in a second, but that's also the website you can use to apply for food benefits online. So it's a good resource you can use to screen if you might be eligible. And then if you are, continue right on to the application. Just some more info about basic food, income limits, and resources. A lot of people wonder if resources are considered for basic food or FAP eligibility. resources or assets. For most folks, they're not. There's very specific situations where DSHS does consider that. They're kind of reserved for when individuals in the past or households in the past have had issues with intentionally violating program rules or improperly transferring assets to qualify for benefits. But again, for most people, resources are not considered when DSHS determines whether or not you're eligible for food. There's some income deductions that apply and can really make or break how much somebody is eligible for each month in terms of benefits from that full allotment. The primary ones that we see are there's a deduction for child support that's paid out from the household. There are deductions for housing and utility costs. There's deductions for childcare expenses. And if someone within the household is disabled or over the age of 65, then qualifying out-of-pocket medical expenses can be deducted, which can really make a big difference in how much a household is eligible to receive. In terms of earned income or self-employment income, there's also deductions. For earned income, there's a 20% deduction. So if somebody's working and earning income, then DSHS generally only counts 80% of the income that they're earning when determining how much benefits they're eligible for per month. For self-employment, it's a little bit different. There's kind of two different ways that they calculate the deduction. The first way is that they just deduct 50% of the self-employment, assuming that there are out-of-pocket costs for doing business, like supplies or maybe commercial rent, things like that. But if somebody's self-employment, the cost of doing business for their self-employment business, whatever that is beyond 50%, they can get a larger deduction. But DSHS will require verification and look that over before applying a larger deduction than 50%. On the other hand, if somebody's cost of doing business is less than 50%, they still can apply for that 50% deduction, regardless of the actual cost of doing business. So how to apply? There's a lot of different ways that someone can apply for benefits. You can apply online at washingtonconnection.org. In order to do that, somebody needs to create an account with a username and password, and they also need access to an email address for two-factor verification. People can also apply in person at the local community service office. There is a link here that will help somebody find what the nearest office is to them based on their zip code. And people can also apply via phone by calling DSHS's customer service line. And there's also paper forms as well. Sorry, can we go back to the last one? Great, thanks. There's also paper forms as well. We don't have a link to that, but there you can find that just by Googling DSHS food application. Paper forms are also available in different languages, which is nice. Not every single language, but the DSHS does have a pretty large bank of the application in foreign languages, if that's helpful for applicants. One thing to keep in mind when doing applications either online or through a paper application is that after the application is submitted, it's really important to follow up with the department via phone or in person. Generally, the application process consists of submitting an application and then also doing a financial interview with the department to kind of verify the application and provide any additional verification that's necessary. A lot of people assume that the department will reach out to them once they submit an application online, but in most cases, that's not the reality. And if somebody doesn't contact DSHS to complete the second portion, the financial interview portion, their application will be delayed or potentially even denied. So really important to follow up with the department if you submit an application online or via filling out the paper form and faxing it in. Some information that people should have available after they apply and are doing the financial interview portion is information about their income from the last 30 days before applying, the names, ages, and income information for everyone in their household with whom they buy, prepare, or share food, and then also information about potential deductions that could apply that would increase their benefit amount, like housing costs, utility costs, child support being paid out, or potentially out-of-pocket medical expenses. Just some quick tips for the application process. If possible, Provide proof of income or any other verification the department requests as soon as you can. Like I said, applications can be denied or the minimum delayed if DSHS needs additional information that isn't provided. Sometimes if somebody is working, let's say the first week of the month, loses their job the second week of the month, and then applies the third week of the month, DSHS might require they complete what's called a stop work form just to verify that they have stopped working, and so they can budget the correct financial information going forward. And the last tip is that advocates or anyone really can assist people throughout this entire process. Unless you're an authorized representative, which I'll talk about later, the client or applicant also needs to be there on the phone or in person with you. But they can always have somebody there helping them if they have any sort of barriers with the application process or just interacting with the department directly. Do the next slide. Oh, back at questions. Anyone have any questions about the application process or anything?
Sorry, somebody came off of mute. I don't know if that was intentional or not. If so, I could not hear you. If you could please repeat. In the meantime, I'm going to read some of them from the chat. What about asylum families where neither parent works? As we showed, asylees can no longer qualify for SNAP, but they should be eligible for FAP, the state-funded food assistance. And if neither parent works, then assuming the income is then zero, they should be financially eligible. And as long as they go through and are otherwise eligible, they should get the full amount based on their family size. DV clients who are single with no children who live in DV shelters sometimes only get $23 for food benefits. How do I help them get more? So shelters can be difficult. Shelters, group homes, anything like that, where there are many people living under one roof who potentially share food and or cook together. The department can sometimes assume that that is happening even if it's not the case. And similar to the situation where children have to supply documentation that they are not cooking food with any sort of adult in the family or in the home. The same can be the case for DV clients. So usually it's best to provide documentation that shows that you have your own food storage area, the program requirements do not provide you with food, you are not being compensated in that way by staying there. It's not a guarantee, and unfortunately, again, it is sometimes an uphill battle. The way the system works is to assume that if you live with somebody, you're magically all kumbaya sharing food. If that's not the case, which is many, many people's reality, then the burden is kind of on you to show otherwise. So again, getting some sort of testimony from staff at the shelter or providing proof of any sort of documentation that shows that food is not provided at the shelter can be helpful in that instance, but it is kind of every situation is different, and it might be a back and forth with the department, unfortunately. Do the ABAWD rules still apply? We are going to jump into ABAWD as soon as we finish this question section. So if we don't answer your question in that, please let us know if you still have any. Why is it that adults who are asylum seekers do not qualify? So they do. Asylum seekers and refugees do qualify for assistance. It's just not the federal SNAP program anymore that provides them with food coverage. It's the state FAP program. So all asylees and refugees are still covered. They're just covered out of a different pocket of money. So the federal government has said, we're no longer financially covering you guys. And the state of Washington has said, yeah, we don't agree with that. And we're going to still make sure that you have coverage. And in doing so, are still providing it. It's just coming from a different source.
Excuse me, Patricia.
Yeah.
I apologize, but I don't have the little button on my screen to raise my hand. This is
No
Lydia
problem.
again from Lehigh. What I'm encountering with my asylum seeker clients is that the children are still being provided with food benefits, but the adults have been cut off. So, should I then assist the adults in reapplying or appealing those decisions?
So it depends. They should be eligible as long as they're also asylum seekers. Potentially, if they have applied since HR1 went into effect last July, they might be being cut off due to those work requirements. That would be my guess, with, not having the paperwork in front of me. Because if an adult in the family or the household doesn't meet work requirements, the children in the household still maintain theirs. So that's kind of my inclination as to why it might be happening. But yes, if they're meeting those requirements, they should be eligible. And I would advise reapplying and or asking for a reconsideration of that denial, which we'll get to how to do that later in the presentation as well, because they should be getting it.
So, the work requirements, how do we show proof? Do we
We'll get to that
list?
right
Oh,
after.
sorry,
No, you're good.
jumping the gun.
It's everything about this is so intertwined. It's hard to do questions midway because I don't want to confuse, but we also don't want you to get to the end and have, 18 questions. We want to try and chip away at it. So if after we talk about the work requirements, you still have anything, feel free to pop back on and ask. How do housing and utility deductions work? So you provide, it's usually either a copy of your lease or a debit showing how much you're charged for rent and utilities, and it will be deducted from kind of your eligible income. It's not a dollar for dollar deduction. So in terms of figuring it out mentally, it's basically impossible, although I went into law and not math, so don't quote me. But the income calculator is helpful for that purpose. You can put in how much you spend on rent or mortgage and how much you put in, how much you pay for utilities, and it will automatically put it through the calculation and provide those deductions through that calculator. Can also apply a DSHS mobile office. Yes, you can. Thank you for providing that resource. Can we go back to the income limit slide? I was trying to jot it down. We will be sending out this entire slide deck after the presentation, so you will have it to reference indefinitely. If you don't get it, you're welcome to email me and I'll send it directly to you. I'll have my email on the very last slide of the presentation. Do ASA animal expenses count as qualified medical? It depends. Service dogs or service animals do. Emotional support animals can. You also, it's a case by case basis. I can't give you a general, like, overarching qualification for that. There are a lot more protections built into the law for service animals than for ESAs in terms of these programs. So it's very black and white with service animals, and it's very gray with ESAs. So I unfortunately don't have a concise answer for you. Okay. What have you found to be the best way to follow up with DSHS? Unfortunately, unless you've created a portal with a login to see kind of where you're at in the application process, kind of the only way to know is to call and wait through their sometimes very long wait time to talk with a DSHS administrator to go through it. But they can also schedule you for an appointment with a financial interview, etc. So, can you expand on the work requirements? Yes, we will be doing that as soon as we get back. More work requirements questions. If a client earns more than the income limit, but then with qualified deductions is below it, can they still be eligible? Yes. So that is the purpose of that, those deductions. So if you're right over that limit, you can still apply. And if you're brought under it by those deductions, you should still get services. That being said, if you are making that much, your deductions are unlikely to bring you to the point where you're making a substantial amount in terms of your food benefits. But yes, supply all of that and see how much you can get your clients. Can adult children apply for EBT separate from parents if they're residing with parents? It depends. So DSHS has a very one-track mind in terms of how they interpret families living together and how that works. If you are living with your children or your parents, so 1 degree of familial separation in either direction, they are automatically considered to be part of your assistance unit, and their finances are used in consideration of your qualification and amount, regardless of whether you are completely separate in terms of finances. So we see this a lot when children have like their senior adult parents move into their household, and they're completely separate in terms of finances, but unfortunately their parents can't qualify for those benefits because the child's income is considered towards their parents, and vice versa, so if you're adult children. So unfortunately, all of those finances are viewed together if you are biologically or legally related as parents or children.
Yeah, and one more thing on that is I think age would also play a factor. If you're under 22, then the parents and the children have to be in the same household unit, and so the income has to be combined. If you're over 22 and you can show that your finances are completely separate, that might work. I think it'd be a lot of back and forth with the department, and it might have to require a lot of documentation of that to have them actually accept that. Based on the text of the law, though, someone over 22 should be able to be a separate assistance unit, but again, it kind of probably be a lot of back and forth with the department.
That is fair, valid. Thank you, Tanner. So it's an automatic versus an assumptive or presumptuous. So under 22, it's required by law. Over 22, you can argue it. We rarely see that being successful just because there is that kind of presumption. But thank you. Is the 20% earned income deduction applied broadly to anyone working a traditional job? Yes. So earned income is any form of you provide work in exchange for money. So any job, whether it's salaried, whether it's minimum wage, anything, there is an automatic 20% deduction of that for consideration towards the calculation. And that includes tips that are, so your example of like a restaurant job, you would consider your base pay plus your tips, and then there's a 20% deduction when considering. Ding. Can advocates provide assigned DSHS release to be able to connect on the phone alone without the individual client? Yes. So we do this all the time. It is important to provide the correct paperwork to make sure you have that authorization. There's some paperwork that lets you just call and get like status updates. There's some that lets you call and make decisions. So if the client needs help actually calling and like establishing an equal access plan or requesting a hearing or help in an interview, etc., it's just important to make sure you have the adequate amount of paperwork. But yes, and we can provide that via email if you'd like to reach out if you have questions about what that is. But yes, you can fill out paperwork and call on their behalf without having to have them on the line with you to get answers to questions they may have. And we do that way too much.
A quick reminder, I'm just going to chime in before we move on to the next section. For folks who joined us late, we will be doing an advocacy action in the middle of our training, and then also please stick around for the end as we'll be getting some feedback from people who have attended the training. Thanks, Patty.
Perfect. Is there an exception for grandparents raising grandchildren? I'm not sure what you mean in terms of exception. They can apply, and if their income is eligible, they're treated as though they were the parents in terms of just looking at the household total income, looking at the total number of individuals, and providing the appropriate amount of EBT. If you mean in terms of work requirements, we will get to that. And yes, there are exceptions. Whether they qualify is nuanced, but we will get into the weeds with that. What if adult child is living in college? An adult can apply for it on their own. If they live separately from their parents, they don't need to provide their parents' income. Whether or not they're eligible may depend on where they're living and if they're already getting, for example, if you're in the dorm on financial aid and you're already getting food through your university, you may not be eligible. But if otherwise, you should be able to apply, and the same rules and designations would apply to them as any other individual applying. Is it assumed that adult siblings would be in the same unit? If they live in the same household, it depends on if they share or commingle finances and share and commingle food preparation and purchasing. So it's not automatically assumed, but it is a potential threshold to prove otherwise. But unlike like a married couple has to be in the same assistance unit, two adult siblings do not have to. You would just have to prove that they each individually, separately buy and prepare food and have separate finances. I believe that's everything. Again, if I missed anything, please feel free to put it back in the chat or come off of mute. I am going to move on to what I assume is going to be kind of the heaviest in terms of questions, which is probably what y'all have come here for, which is those ABAWD changes and requirements. So we're going to jump into that next. Okay, so able-bodied adults without dependents, an ABAWD. So the definition of this is those individuals aged 18 through 64. You'll see that 64 is in red. That's because that is a change that is made from HR1. It used to be 60 or 59, so 60 and above was exempt. Now it's been raised by 5 years. So the work requirement used to be only for people from 18 to 59. We've extended that. They also must not be getting food benefits for children under 14. So if you are an adult in the household who's a care provider for a child under the age of 14, you are exempt from work requirements as well. If you are able to work and have no physical or mental disability, injury, or health issue. So if you have, we'll get into the weeds, but if you have if you're receiving benefits due to a disability, so if you're on ABD, if you're on Social Security for disability, you're automatically exempt. If you have a quote unquote obvious disability, which don't get me started on what that means, but if you can provide medical proof that you have a disability that impairs your ability to work, you can also become exempt, whether that is a physical or mental disability. And if you can receive food assistance for so if you should be working, quote unquote, under these rules and you are not, you still can get food assistance for up to 3 months before they cut you off. And that's supposed to be kind of an interim gap so that if you get laid off, if you are injured and you need to quit, if you move and you have time in between that where you're not working, any situation that requires you to not work, you don't automatically lose your benefits. There's a 3-month kind of safety net in place. That being said, it's a 3-month safety net that resets every 3 years. So if you are unemployed for whatever reason, temporarily for 3 months, and then 2 years later, you have another situation where you're unemployed, you've already used up your safety net. And so you would automatically lose those benefits. But then as soon as you get employed again and meet the work requirements, you would be re-eligible. Work requirements were suspended during COVID, but they're back. And because of HR1, they are bigger and impacting more people, which is what we're going to get into. So what are they? ABAWD requirements are basically the government is trying to say if you are asking for food, you need to be trying to support yourself. Again, nobody asked me, so I'll keep my opinions to myself. However, the new requirement is that approximately 20 hours of work must be provided or done per week or 80 hours per month. It has to be either an employed position or it can be a volunteer position as long as it's through a work fair or an approved organization. The number of volunteer hours is determined based on the benefit amount divided by, okay, so the federal minimum wage is what is considered in terms of eligibility if you are volunteering. So if you are not getting paid and you are volunteering 20 hours a week, the number of volunteer hours is based on the federal minimum wage and not the state minimum wage, which is higher. You don't need to know all this nuance. The reality is just if you are volunteering 20 or more hours per week, you are meeting this ABAWD requirement, and in terms of calculation, they will do that on their side. There are also some state-approved employment or training programs that qualify in lieu of a job or volunteer work as well. It's a very specific list. We provided the hyperlink in the presentation, which you will be receiving. But those can be useful if somebody is like transitioning between jobs and is looking for a pathway into a profession. There are good cause exemptions for not meeting these work and volunteer hour requirements. You should contact DSHS immediately if those good cause exemptions apply. So for example, if you are on your way to work and your car breaks down and you miss a shift, and therefore that week you don't have 20 hours, you can call, let DSHS know, an emergency came up, it was a good cause for me not meeting it this week, and they can approve you to continue getting your benefits without having to use that 3-month safety net, if that applies. That being said, we don't know how HR1 is going to potentially interact with this good cause exemption. We've never actually seen it play out. As of right now, there's nothing in the law that says that the good cause exemption no longer applies. That may change, and if so, we'll keep everything literature-wise updated. But I just like to bring it up as a consideration in the back of your mind to be thinking of. But as of right now, good cause does apply, and you can ask for basically temporary coverage if you have an emergency that prohibits you from meeting those work requirements. That being said, like it says, there are multiple exemptions to the work requirements, and we will get into those. So these are the exemptions. Prior to the HR1 rollout, work requirements did exist. However, every county except for Snohomish and King County was automatically exempt from those work requirements due to the rates of unemployment versus the job availability. That is ending. So because that is ending, every single county in the state of Washington, actually in the country, but we're going to focus on Washington, is now required to meet these work requirements. And these work requirements have shifted so that there are a lot fewer exemptions outside of that geographic exemption. So usually, previously, when you call to do your eligibility screening, if you lived in any county except Snohomish and King, they would check a box that said you lived outside, and you would automatically be exempt from ABAWD requirements, that you wouldn't have to work. Now that exemption is over. So instead of being cut at that level, at that bracket, and having no other questions asked afterwards, they then go on to their further questions. And like it shows here, there used to be quite a few exemptions that have now disappeared. And then we've had 2 changes. So it used to be that if you were on unemployment, you were still meeting the requirement and could get benefits. That's no longer the case. It used to be that if you're a student enrolled at least half time in school, that was an exception, and you would still get benefits automatically. That's no longer the case. You do also have to be meeting these work requirements. Used to be that if you were unhoused, you also had an exemption because it's quite hard to seek employment if you don't have somewhere to live. Unfortunately, that's no longer the case. It used to be that if you were a veteran, you were automatically exempt. That's no longer the case. And if you were in a drug or alcohol rehab program, you are automatically exempt. And that is no longer the case. So a lot of individuals who in King County and Snohomish County who previously did not have to meet this requirement do now, because all of those distinctions have ended. However, there are still exemptions in place, and those exemptions are, like I said, if you're physically or mentally disabled, and one way of showing this is if you either temporarily or permanently receive disability benefits from a government or private source, you are found to have met that threshold for being physically or mentally disabled, and you automatically don't have to meet those work requirements. If you yourself are the one applying for and receiving benefits, or if you're the only one in your household who qualifies for those benefits, and you're under 18, you do not have to meet those work requirements. If you are over the age of 65, you do not have to meet those requirements. Like it shows here, it used to be 60. So if you have a client, for example, who's 61 and last year they didn't have to meet those requirements because of their age, they may need to now, unless they qualify for a different exemption. You do get automatic exemption if you're American Indian or Alaska Native. And you do get an automatic exemption if you have a child in your home who is younger than 14. Again, that is a shift. It used to be 18. It used to just be any minors in your household, you were exempt. It is now any young minors, so under the age of 14. You are also exempt if you are pregnant. So if you are about to have a child, you may be exempt from this, and you may be eligible for WIC. You can be dual eligible. But once you've had that child and are no longer pregnant and you're postpartum, you are required to be back in the workforce unless you can show that your postpartum condition has left you disabled temporarily to the point where you cannot engage in employment. I anticipate a lot of questions. I see things popping up in the chat. I will answer those literally right now. I'm going to leave this slide on the screen though, because I anticipate there being a lot of questions about this slide. So we're going into the questions, but I'm going to leave this up so that we can reference it. Okay. I volunteer at a non-work fair, non-approved volunteer site. Does that count? So it does have to be approved. There is a application process that the nonprofit or the volunteer association can go through to become an approved source for those hours to count, but it's not automatic, mostly because their fear is that people will make up or volunteer at associations or at facilities that either don't exist or don't provide actual volunteer work. So they're trying to cut down on fraud, and in doing so are making that requirement or that threshold more difficult. But it is something that you can bring up to your volunteer association if you're volunteering somewhere, and ask them to go through that process. I do see a raised hand if you'd like to come off of mute.
Hi, I have a question about, you mentioned about being pregnant and then after you give birth, you would not be eligible. I'm kind of confused, like how would that differ from then having a child in your home who is younger than 14? Wouldn't that be considered having a child in your home who is younger than 14?
If you
Then?
maintain guardianship of that child, yes. Apologies. So if you give birth, you maintain custody of and guardianship of your child, you would then fall into the other bucket of having a child under 14. That's not always the case though. Sometimes people have split custody situations where you give birth, but then the other guardian or their grandparents or another family relation is the one actually caring for the child. And they would be the ones who would be able to meet that exemption by having a child under 14. Or they go into the foster care system, or if there's a complication with pregnancy and there's not a successful live birth, you are correct that is the norm, quote unquote. I just want to distinguish that there is the automatic presumption that individual maintains that exemption after giving birth is not there. That being said, they may very well fall into that other pot of exemption eligibility. It's just not guaranteed for the reasons I just said. If that makes sense.
No, that makes sense. I just had another quick question in regards to the work requirements. So work requirements that wouldn't consider someone who is trying to find a job. So those 20 hours can't be like time that they've put into trying to find a job?
Unfortunately not. TANF work requirements, that is considered meeting the work requirement if you spend at least 20 hours a week applying for, interviewing for, seeking employment, or going through unemployment like classes and training. It's automatically considered qualifying. Again, because this is a federal requirement that's being kind of top-down implemented, Washington State does not have a say on to that depth, and we have to meet the federal requirement, which does not allow that to be considered, at least as of right now. I'd love to see that change, for that unemployment search for employment to be considered hours of employment.
Thank you.
Yeah. Which looks like it kind of has to do with one of the questions in here. It looks like, Kevin, you mostly answered this, but for work requirements, is this workforce first or workforce related? So yes. So TANF is the one that used to have work requirements. It was, and King County. So Work First administered it. They're now trying to ramp up to still provide services and support for everyone through SNAP, but the requirements are completely different in terms of exemptions and in terms of, like I said, seeking employment, etc. So we're still in kind of a scaling up process of seeing how those resources are going to be allocated and that support given, but it is different. Is there a grace period when a person can reapply for SNAP if after 3 months discontinued? So as soon as your client has employment, and regardless of if they've used up their 3-month safety net, as soon as they meet that work requirement, they can reapply. Unlike a disqualification for like a violation where there might be a period of time where they're kicked off of benefits, this is just, oh, you no longer qualify, so you lose the benefit. It's not any sort of reprimand time where you're no longer allowed to apply. It's just that when you apply, you need to already be meeting the work requirement because there isn't any more of that kind of safety net for between employment positions.
Hey, I know there's a number of questions, and I think we'll still be able to address some of the ones from this section a little bit later, but I do want to chime in and just make sure that we're staying on time. We have Hallie, our policy manager here, for an advocacy action. If you want to transition us over, I don't know if you had one more question on the tip of your tongue that you were going to get to.
Let me look through. So I feel like this is important to throw out there. Approved volunteer organizations, you can find a list of what those are and what the qualifications are online and I can provide that link as well. While you are doing the rest of your advocacy presentation, I can put that link into the chat for everybody. And for other questions, if we can't get to them, like I said, you can participate in our Ask a Lawyer program and send us an email with questions, and we're happy to answer those as well. And hopefully, if we have time at the end, we'll continue answering as well.
Thank you, Patty. Okay, everyone, I'm just going to transition us over really briefly for a quick advocacy action break. Hallie, can you see am I sharing screen now, and can you see the link?
Yeah, that looks great.
Okay,
Thanks,
perfect.
Kevin. Thanks so much. Hi, everyone. My name is Hallie Willis. I use she, her pronouns. I'm the community policy manager over here at the Seattle-King County Coalition on Homelessness. I'm here to invite folks to take action because you are here for two purposes, one of which is to learn how to navigate this extremely complicated system that has become much more complicated, much more burdensome, and much more limited as a result of HR1 in order to best serve your clients. But also, we're here to invite you to take action to fight for a better system and help fight undo some of these changes to SNAP. I'm going to drop a couple links in the chat so you have them ready when it's time. And I want to acknowledge first that I saw some questions in the chat about like, why are these changes being made? And I think Kevin addressed it beautifully, but really why these changes are being made is because Congress and the president has certain members of Congress, I should say, and the president have decided to strip away life-sustaining benefits from our most vulnerable community members in order to shift that money over to provide tax breaks for our wealthiest people in this country. Like, that's why. And that is wrong. And we are here to fight for that to be undone and to fight for a system that meets people's needs. So I'll invite people to click on that link in the chat. That will take you over to a campaign from our friends at the Food Research and Advocacy Center, I think it's called. I'm not so good with acronyms all the time. This is urging Congress to reject the current iteration of the Farm Bill, which is the bill that funds a lot of SNAP, because it does not restore any of the $187 billion that was cut in HR1. And it doesn't right the wrongs that were done to SNAP in that really bad federal bill. So please go ahead and fill out your information. We always encourage people to use their personal email address when you're sending letters to elected officials. If you have time and if you have a personal story to tell or a personal touch to add to that letter, that is always a great idea to add that when you're sending letters to elected officials. But as I always preface for folks, if that's the thing that's getting in between you and sending the letter, if you're like, oh, that takes too long, I'm not sure what to say, I'm not going to send this letter, that's okay. Just send the letter. Like, it's more important to do the thing than to do the thing perfectly. So please go ahead and send a letter to your elected representatives, urging them to fix these terrible changes to SNAP. Also invite folks to sign up for the Coalition on Homelessness's action alerts. If you sign up for that list, we will email you when it is time to speak up on important issues like this, but also lots of other issues that affect people experiencing homelessness and people living on low incomes. So with that, I will go ahead and pause and just see if folks have questions about the advocacy section. And I might ask Kevin for help facilitating if there was anything that came in through the chat.
You know, I'm looking at the chat, not a lot of questions. I think people were listening very diligently and are probably, I can see eyes busy on the screen, just submitting the letter. So thank you all so much for taking the time, taking a little break. I know sometimes we hear this information, it can be very frustrating. And so hopefully this advocacy action is an outlet for that. And like Hallie mentioned, we love to bring these opportunities to you all in this community. So if you're not signed up for our action alerts, that is in the chat, please do so. If you have questions, go ahead and ask them in the chat. We're looking for those right now.
Thanks, Kevin. And I will keep an eye on the chat. So if folks have additional questions about advocacy, feel free to drop them there. And I'll hand it back over to Kevin and Patricia. Thank you.
Thank you, Hallie. Yes, these links can get shared out with your staff as well too. So don't be shy about sharing those out. I'm going to stop sharing this, and so that way Patty and Tanner can get right back to it. That looked like it worked. I'm not quite seeing the other. Oh, there it is. Okay, thank you all. We'll still be monitoring the chat for any questions regarding the advocacy action and, of course, any other questions that come up with the content.
Okay. Thanks, Kevin and Haley. So a few more slides. We'll try to breeze through these because I know folks have a lot of questions and these slides will be distributed. So we'll move a little quicker through these next few slides. A lot of these are just to speak on some common benefit pitfalls we see and some helpful tools for avoiding them. One big thing to keep in mind for anyone who's receiving food benefits, or if you're working with people who do, is to stay on top of reporting changes to DSHS if anything changes in their household that they need to report. Things like changes of household income, household size, a lot of other things that might impact eligibility need to be reported to DSHS by the 10th day of the month following when the change takes place. So in easier language, that effectively means if you're not working in May, you start working in June, then you have until the 10th day of July to report your new job to DSHS and whatever income you're receiving from it. It's really important to stay on top of this because any sort of change like that could impact the amount of food assistance that somebody's eligible for in a given month. And if you don't report those in time, you might be receiving more benefits than you're actually eligible to receive. And when that happens, whenever DSHS learns about that, whether it's at a mid-certification review or an annual review, they will generate an overpayment and you will be expected to pay the difference back. For food benefits, it's also very hard to find any sort of forgiveness for those overpayments if they are properly calculated. So really important to stay on top of reporting changes. If anybody has any questions, if something happens in your household or a client's household and you're not sure if that's something that needs to be reported or the best way to go about it, you're welcome to contact us at BLA, or you can contact DSHS to just report it out of abundance of caution. But important to stay on top of that. Also important to stay on top of work requirements or any sort of program requirement. People are regularly getting terminated from benefits based on these new work requirements. Very important to stay on top of it. Also important to be proactive about contacting the department if you think an exemption might apply to you, whether that's an ongoing exemption due to disability status or anything like that. Or maybe you failed to meet your work requirements for a given month because you had the flu. These are sorts of things that can be limited exemptions for any given month if you don't meet those program requirements, but it is important to reach out proactively to the department so your benefits don't get terminated if something like that were to happen. A few other tips here. One is that beneficiary recipients can request what's called an equal access plan. DSHS must provide accommodations to people who have mental, neurological, physical, or any other limitation that might prevent them from accessing or maintaining benefits. So essentially, if somebody requests an accommodation plan from DSHS, they have to provide one. They kind of have some preset accommodations that they provide to people that can include giving them more time to provide verification, maybe calling them instead of just sending notices when there's a change of their benefits. Some people, you can get a private room to complete interviews rather than having to do it around other people or over the phone. So there's a lot of different accommodations DSHS can provide. They're supposed to be proactive about setting these up when they notice that a client might need assistance. In reality, sometimes that doesn't happen. So oftentimes the best course of action is to assist somebody you're working with, or if you're struggling yourself to comply with the requirements, or just engage with DSHS to call in and ask for an equal access plan to be set up for you. Another thing that can be really helpful is designating what's called an authorized representative. This is somebody who, even more than just discussing your status of your application or something like that with the department, they can actually act on somebody's behalf with regard to applying for benefits or anything to do with maintaining those benefits. You can designate somebody like an individual or even an organization to act on your behalf. And another really helpful thing about having an authorized representative is that DSHS can send mailed notices directly to that representative in addition to the recipient themselves, which can be really helpful for people who might be going through housing instability or maybe having a hard time understanding written notices when sent to them. So having an authorized representative can be very helpful for a lot of people, just kind of dealing with the bureaucracy of the system. So what do you do when something goes wrong? And when something goes wrong, we mean if somebody's benefits are denied, the benefits are reduced, if benefits are terminated, or maybe someone receives a notice of overpayment saying that they owe money to the department. The primary course of action would be to request an appeal or file an appeal, which is requesting a hearing. When you do that, a court date gets scheduled before an administrative law judge that will review whatever's going on to make sure it's legally sufficient and that the department has a legal basis for taking whatever action they're taking. In addition to that, a specific individual is assigned from the department to review the case and, if necessary, represent the department at that hearing. Oftentimes, if the department is taking an action that's incorrect, or if the whatever's going on is curable, you can work directly with that person who's assigned to review the case even prior to the hearing to get whatever's going on resolved. But it is important you request a hearing to have both the court date scheduled for the judge to review the case and also for someone in particular to be assigned to review whatever's going on. How to request a hearing? You can do that by calling or writing DSHS or the Office of Administrative Hearings. There's really not like a magic word or phrase that you need to say to request a hearing. In fact, the department's supposed to treat kind of all clearly communicated disagreements with actions they're taking as hearing requests, but in reality, that honestly doesn't happen. So it is very helpful if you want to request a hearing or help someone request a hearing, just to call DSHS or the Office of Administrative Hearings and simply say you disagree with a change occurring and that you want to schedule a hearing. We have the phone numbers here for the DSHS customer service line where you can call, as well as the Office of Administrative Hearings. Once someone files a hearing request and that hearing's scheduled, they have the option of being represented by an attorney, any sort of advocate, or even a family member or friend during the hearing process, as well as at the hearing itself. There is a deadline, though, for requesting hearings. Generally, it's 90 days from the notice that's sent out notifying the beneficiary about whatever's going on, whether that's a termination, denial, or reduction of benefits. So you normally have 90 days from the date on that notice to request the hearing. You can request hearings after that 90 days if you're requesting it within 1 year of the date on that notice. And that appeal may or may not be accepted, depending on if you can articulate a good reason why the hearing was late. There's not like an exhaustive list of what constitutes when you can file a late hearing request, but obviously things like housing instability, maybe someone's experiencing medical issues during that 90-day period. There's a lot of different reasons that can support filing a late appeal. But generally, obviously, the safest bet is to do it within 90 days if possible. One other part of the hearing process is that if somebody requests a hearing within 10 days of the date on the notice, that's notifying them of whatever's going on, whether that be a termination of benefits or reduction of benefits, they can opt to continue receiving benefits at the same amount that they were prior to the reduction or termination while they wait for their hearing to take place. This is a good idea sometimes and not so much of a good idea other times, because If somebody opts to receive continuing benefits and then they either withdraw from the hearing or they attend the hearing and the administrative law judge sides with the department, saying that the action being taken is legitimate, then that person who received the continuing benefits might have to repay them as well to the department. However, when people are really in dire need of the benefits, or when they have a very strong belief that whatever is going on is illegitimate, then continuing benefits are often a very good idea. And but yeah, it's something to be careful about. And so referrals to BLA, how to get in contact with us. We have an intake line at the phone number listed right there. You can just leave a voicemail there with your name or the name of somebody who you're working with who might need assistance. We're pretty good about checking that intake line. Generally, people get a call back within 24 hours. You can also contact us at our email address that's listed right there. And you can also contact us directly. You can contact Patricia at that email listed right there. And you can also contact our program's legal assistants, Janelle Stark, at that email.
Thank you so much, Tanner. I know we've got a number of questions. I see Patty is on as well, and you guys can go ahead if you have a few that you're ready to start with.
I've been trying to answer everybody's questions in the chat. That being said, it's a very active chat. So if I haven't responded to you and you'd like to speak up, please feel free to do so. Oh, when are the changes starting? So they have started. The eligibility designation between SNAP and FAP is starting in May. The ABAWD requirements have started. That being said, they're being enforced and rolled out on a rolling basis. So because of capacity issues, because DSA just doesn't have the capacity to just reevaluate every single person overnight, they are doing it on a rolling basis at everyone's reevaluation period. So when your benefits come up for reevaluation or reaccreditation, they are going to re-review your case and see if you meet any of the new exemptions for your work requirements. And if so, you'll change your designation status from whatever you were previously to the new ABAWD exemptions, or you will be then forced to comply with the work requirements. So logically, it's a bit funky because you may be helping multiple clients or individuals, some of whom are currently having to comply with these work requirements, and some of these who are not because their re-enrollment has not hit yet. So I'm aware that it's an yes, so this is a mid-certification or an annual. So anytime they're certifying, they are re-reviewing and seeing if you're eligible. So it could be that you're helping someone meet these and their neighbor, their sibling, their et cetera, that they know has not had their recertification, and so they're not meeting these requirements yet. So it's a little bit clunky, and I'm aware that it brings up some equity issues, but realistically, they just don't have the manpower to automatically enforce it on everyone. So you do have to there's some nuance to when and how this is taking effect.
And just a quick reminder that those recertifications happen every 6 months, and then the annual one every year. So if your client started or had their annual review in October, then it's going to be 6 months from there into this year, or November. While we're doing some questions here, I'm just going to switch us over to our other closing screen with our feedback form. But please, folks, please still continue to ask questions. For the feedback, I'll chime back in and share more details, but you can go ahead and get started on that too if you want to click the link. We do have some gift cards for folks who are taking part in the feedback. So thank you all so much in advance. I see a couple new questions. Oh, I thought they were new questions.
So one of these, I'll just reiterate because I did put it in the chat as well. SSDI, SSI, SSA, VA, potentially VA, and ABD. Yes, those automatically qualify you for ABAWD because the exemption because they count as a disability status that meets the disability exemption. Veterans Association depends. It depends if you just did your service and then ended without a disability, or if you ended your service due to a disability. So if you are designated as being disabled by the Veterans Association, yes, you would meet those requirements automatically, or that exemption. If you did your service and were not designated as disabled, then you would still need to meet those work requirements because being a veteran is no longer an automatic exemption like it was previously.
See one new question with the new ABAWD requirements. Is it all or nothing, or does not meeting the requirements just mean less money being distributed to individuals/families? Unfortunately, it is all or nothing. So if you're not meeting the ABAWD requirements, you're not going to get anything. It would make more sense that if you're maybe doing half the work requirement, you get half the benefit, but that's not how it works. It's all or nothing.
And also, are these referrals for legal assistance available? Where? So we operate and provide legal assistance only for King County, unfortunately. That is where our grants allow us to provide full legal representation. Outside of King County, it's possible that you can refer people to Northwest Justice Program. I know they, on a limited basis, provide this assistance. Outside of that, unfortunately, there's not other full representation available in the state of Washington. That being said, if you have just a question about eligibility, or about, like, if you have a client and you're going, ooh, that doesn't seem right, I want to know whether it's worth my client requesting a hearing, for example, you can email us in our Ask a Lawyer program, and we can provide you with broad advice. Legal advice. We just can't actually take on a client outside of King County and provide full legal representation, unfortunately. I'd love to do statewide. I actually live in Whatcom as well, so I'd love to do it. But unfortunately, yeah, our funding has very strict guidelines in terms of geographical services. So is there a date when cash/TANF requirements will be discussed? We will be doing all of those trainings. I don't know, Kevin, do you know if those dates have actually been finalized yet?
Nope, dates have not been finalized, but please stay tuned. We will be announcing those relatively well as the calendar rolls on. But please sign up for our email list. Yes, Allison.
Oh,
I just want to say, this is the reason that we're asking you to complete the feedback form, because we know there are many questions that, despite heroic work by Patty and Tanner today, we won't completely get to in the course of this training. You will get the slides, you will get the recording, but we are inviting you to complete the feedback form so that you can be on our list for future trainings, and also so that you can sign up to be part of our Advocacy Action Network. And you can share the stories of how these changes are affecting real people whom you work with in your communities. Because as Kevin and Hallie have expressed, the whole reason that we are partnering with Benefits Legal Assistance to offer this training as information for you to help the folks whom you work with is that we also don't accept that these changes are necessary or good for people in our community. These are punitive changes that are designed to limit who can get access to food, and we reject that. How are we going to take action? Well, in the feedback form, you've got an opportunity to sign up to be part of taking action with us. So if you want future trainings, I really hope you'll take 5 minutes to just give us a quick little piece of your info and your feedback, and we will be happy to partner with BLA and others to bring you more trainings.
Thank you, Allison. I just want to address a quick question in the chat. Jacqueline had asked or mentioned that law advocates, that's up in Whatcom County, sometimes has pop-ups at the library, lawyer at the library, and there's another comment saying the Everett Library also does those. Just keep in mind that, the rules or the laws around DSHS are a little, are kind of its own, their own set of laws, WACs as opposed to RCWs, and so I would really encourage you to take on Patricia's advice and still call benefits legal assistance for that consultation. You don't need, you don't necessarily, might not need them to take on your case and represent your client, but they are experts in appeals and specifically these programs. So you might have better luck getting a consultation from an attorney who works in that area.
Yes, and just to clarify, please email us for that so that we can provide written clarification and advice. If you call us, we will try and call you back, but it is much more expeditious to email us. Also, like I said, I live up in Whatcom. I love the law advocates. They're amazing. They are general attorneys, though, giving general legal advice. And so, like what Kevin said, they don't necessarily specialize in this area of law. So if that's good for your client, then great. But we're also happy to provide our input as individuals who work only in this area of law. So, but yes, that's a good resource as well. We're wrapping up. I know the survey's been put into the chat. If everyone can do that, that would be great. We also have a few more minutes left. So if you still have questions, feel free to put them in the chat or come off of mute. We also can end the recording if that would encourage anyone to come off of mute. I know sometimes people don't want their question to live forever on YouTube.
Where can we find the list of volunteer organizations that are approved? And is there a way to find out like how to become one?
Yes, we did put it in the chat, and they will be sending out a summary of the chat in the follow-up email along with the slides, but I can also go back and look for that link to put again.
Oh, sorry, I was looking through. I just didn't see it, but I'll just keep looking through it. That's right. You don't have to do it again.
It's a very large chat. It's easy to lose things, which is why thank you guys for providing that summary as well. I think that'll be very useful. She's a complicated chat.
I guess clarification following up on his question. I went to the link you sent, kind of dug through, and it seems like the only approved volunteers through WIC Fair. It said for a client to figure out how to volunteer through the organizations or through WIC Fair, they have to call a number that links them to DSHS. So does that sound accurate? I have the direct link to like where it says that, but from what I'm saying is you can have volunteer through WIC Fair and to volunteer through WIC Fair to call DSHS.
I don't know whether this is just me.
No.
Your audio is cutting in and out to the point where I can't quite understand what you are saying. Do you mind putting it in the chat or sending me an email? And I'm happy to reply. Apologies. I couldn't catch that.
No, there was audio issues on our end as well. Yeah, our apologies. But yes, if you can put that question in the chat or send Patty an email directly. Going to go ahead and end the recording now. Thank you all so much. We're still answering questions, so hang on.